This last part of the lecture is going to focus on eating disorders, including obesity, anorexia, and bulimia. With obesity, we see that it's becoming a serious problem in more and more countries, especially in the United States, and we will talk about some factors that might be related to the increased rate of obesity. We know that anorexia and bulimia are also problems, and we'll talk about some factors related to those as well. Beginning with obesity, thinking about some factors related to obesity, we see some research that diet is related to obesity, and this includes prenatal diet. So thinking about babies who are born to women who are consuming a high-fat diet, we actually see that these babies can be born with a larger than average lateral hypothalamus. Remember, we talked about the lateral hypothalamus is involved with eating. We also see the postnatal diet, so having high-calorie foods, eating high-fat diets. Of course, that can be related to developing obesity. People who do consume those kinds of high-calorie foods tend to find other kinds of foods, other rewards, less rewarding. There's, of course, the influence of genetics. So we had talked before about the melanocortin is related to eating or related to the satiety, that feeling, that sense of fullness. And so some people have a mutated gene of the melanocortin receptors, which means that they don't have that feeling of fullness. So they might be overeating and not really feeling full. The Prader-Willi syndrome is a specific condition that is marked by intellectual disability, short stature, and obesity. And in this condition, there's about 5 times more ghrelin than is normal. And if you remember from last time, ghrelin is something that basically stimulates appetite, stimulates, for you to eat. So in this condition, there's way more ghrelin than there should be, so people eat. So there is some diet, there is some environmental factors, there's genetic factors. Most likely, though, it's an interaction of genes and environment. We know that not everyone develops obesity, but we can think about the interaction. Some other environmental factors, we can think about food. We can think about the unfortunate fact that healthy foods tends to be way more expensive than, fast food, high-calorie, fatty foods, things like that. So that's an unfortunate challenge for a lot of people, that maybe not having access to healthier foods, maybe not being able to afford healthier foods, maybe not having the time to shop and wash and cook healthier foods. We also see that in general, we tend to have more sedentary lifestyles compared to our ancestors. We tend to have more increased portion sizes. And of course, thinking about, again, with what's in the food that we're eating, foods that are affected or treated by hormones and added sugar and all these kinds of things. So a lot of environmental factors, and then interacting with perhaps some genetic predispositions. In terms of trying to lose weight, diet is often not usually effective. A lot of times what happens if somebody is trying to restrict their diet or eat certain things and for a period of time, and then once that period of time is over, they'll go back to whatever they were eating before. Or if they're trying to eat smaller meals, and then they'll end up being hungry and overeat in the next meal, which really doesn't help. Adjusting lifestyles tends to be a little bit more effective over time. Of course, this is a lot more difficult for people to do. So increasing exercise, decreasing eating, or rather modifying what they eat, cutting out sugar, cutting out soft drinks, trying to focus on the healthier foods, things like that. There are some appetite suppressant drugs that are supposedly simulating the satiety kinds of neurons, so trying to let your brain know that you're full. Of course, there's also surgeries, gastric bypass, things like that, which, yeah. Lifestyle is definitely something that we do see some more evidence for that, but again, that is more challenging or can be more difficult for a lot of people. Thinking about anorexia and bulimia, these eating disorders we tend to see more common in women than men, although men can develop these as well. But we can think about why is it more common in women? I think this is something we'll come back to in a little bit. With anorexia nervosa, this is the refusal to maintain a minimal normal weight. This is characterized by a distorted body image. A lot of times people with anorexia nervosa will look in the mirror, and we can think about this picture, that they're severely underweight, but they'll look in the mirror and see themselves as fat. So they have this very distorted body image. They're really afraid of gaining weight. Even in reality, they are even dangerously underweight, but they're just so afraid of gaining weight. They'll starve themselves, not eat enough. They might be exercising excessively because, again, they're just so focused on not gaining weight. As you can imagine, this can have a lot of negative side effects. I mean, starvation itself, can affect body systems, can affect your body to not work so well. We see lower basal metabolism. We see lower blood levels of glucose, insulin, and leptin. Hormone levels can drop. In women, the reduced hormone levels can stop their menstrual cycles. In men, the reduced hormone levels can decrease their sex drive and sexual function. Anorexia can influence their breathing, their blood pressure, their bones, their skin, everything, their body. Bulimia nervosa also has kind of that distorted body image or preoccupation with gaining weight, although usually bulimia stays within the normal weight. There is still that fear of gaining weight. Bulimia can be accompanied with binging, where you're eating more than you would normally eat in a single session. And then often there's the binge and purge. The purge is to compensate for that binge. So a lot of times during a binge, people feel out of control. They just eat and eat. It's not something that they can control. It just happens. And then the purge could be inducing vomiting or using laxatives or excessive exercise to compensate for that binge, to try to get rid of that body weight. Again, bulimia also has some negative side effects, serious health problems. Of course, they can get dependent on laxatives. They can have the low blood sugar. They can damage their teeth and their esophagus from inducing vomiting. They can have anemia. They can develop anemia. Again, there are a lot of negative side effects with bulimia. When we think about some factors that might be related to the development of these disorders, disrupted brain chemistry is something that we see with both anorexia and bulimia. The hypothalamic pituitary adrenal axis, or the HPA axis, is something we're going to talk about when we talk about stress. This part of the brain is involved with our brain's response to stress. So we do see some abnormalities with the HPA axis. We see some abnormal levels of endorphins and norepinephrine. We also see, especially with bulimia, we see some interesting things with the nucleus accumbens. If you remember back when we talked about drug addictions, we talked about the nucleus accumbens is one of the areas of the brain involved with kind of rewarding and with the addictive substances. And so what we see with bulimia, that doing that binging, having the tasty foods, can stimulate the nucleus accumbens. It can be rewarding. Even the purging might be rewarding too, because then they feel better. They don't feel guilty over the binge. So in some of these ways, bulimia is kind of like a drug addiction, or at least it's stimulating some of the same brain areas as addictive drugs, namely the nucleus accumbens. We do see some comorbidity with some other psychological disorders. Comorbidity just means that they might occur together. So we can see some people that have anorexia or bulimia also have depression or substance abuse, personality disorders. Anxiety disorders is a big one because for some people with anorexia, they feel like their lives are out of control. So they really want to have some sense of control, and limiting what they eat or limiting eating at all can be kind of that sense of control. They can control at least one thing in their life. Bulimia nervosa, we can think about the binge, and especially the binge and purge, can be kind of like obsessive compulsive disorder, where or especially that compulsion, you binge and now you have to purge because you got to do this and got to not gain weight and things like that. So anxiety disorders can occur with these eating disorders, but also again that sense of anxiety or loss of control can be important for these disorders. And then some environmental factors, let's especially focus on some family factors. So one thing, and these are correlations, so not that they are causing, but some things that are correlated, that some family factors that having a mother who is excessively focused on her weight can be related to the child being focused on their own weight, the kind of the observational learning. Having a mother, and also other family members too, that are critical of the child's weight as the child is growing and developing. And of course, we know at puberty there are a lot of changes. Having people who are critical of that, you can imagine that's not so great. And so that could be something related to possibly the development of anorexia or bulimia. Again, along those lines, the negative evaluation from family members might then be related to one's negative evaluation of themselves. We do see for bulimia, if there is obesity, especially child obesity, runs in that family, that could be related to potentially developing bulimia. For anorexia, families that tend to be more competitive, more high achieving, more protective, again, not that it causes anorexia, but it can be related to that. Cultural factors too, and this kind of gets back at that gender difference, that unrealistic ideals of body appearance, pressures of unrealistic body appearance. And we know guys experience this too, but especially in our culture, it seems like there's a lot more pressure on women to appear a certain way. We look at magazines that are all photoshopped and airbrushed and everything that is just, it's not realistic. But girls, these eating disorders we see especially higher prevalence among adolescents and young adulthood. And so again, you've got puberty going on, you've got changes in your body going on, thinking about your body image is kind of changing, and then girls are looking at magazines, looking at TV and whatever online and things like that, and are, can feel that sense of dissatisfaction that they don't look like how the magazine looks. We also know from some sports, some athletes can be pressured too. Things like gymnastics, ballet, modeling, those individuals tend to be a little bit at higher risk because there can be that pressure to achieve a certain weight. Wrestling is another one too, that having that pressure to be at a certain weight, and so that could influence them that, oh, I have to lose weight. In terms of treatment, force feeding, that sounds great, but especially for anorexic individuals who are so low weight that, they need to be admitted to a hospital or something. And so these are the very extreme cases, inpatient treatment, that have force feed diets to increase the calorie intake. Family therapy, since there are so many family factors, having family therapy where all the family members come together and kind of modify, or parents might be coached to find effective ways to help control their child's eating behavior. Eventually, then the control is more with the individual themselves, so, helping with their own eating behavior, but again, having the family to help with those family dynamics. Cognitive behavioral therapy can be helpful, that help increase that motivation to change, help with replacing unhealthy dieting with healthier dieting, with more regular, more flexible patterns of eating, helping reduce that unhealthy concern, replacing with a more positive body image, preventing relapse. CBT in general can be more helpful. But one thing with therapies is that many therapies result in short-term success, so not so great for long-term. CBT is something we do see actually is fairly effective for binge eating. A few factors that could be related or maybe interfering with the process of treatment can be self-esteem, body image, and environmental influences, especially family dynamics. So CBT does sound promising. Some other therapies might be promising, but we have to keep in mind, especially that family dynamics, and having people around you supporting you, that can be more helpful, rather than if the environment is not as supportive and you're on your own and trying to do that, that might be related to the more short-term success. Okay, next time we're going to talk about emotional behavior, and let me know if you have any questions on this lecture. Okay, bye.